Hey everyone, Hannah here from Preferred Physical Therapy, where we help people aged 40 and above stay active and independent, live free from painkillers, and avoid surgery. So this month is all about the knee, and today I wanted to discuss a little bit about squat form, how you can hopefully help to prevent or even just avoid any knee pain while doing any squats, either at the gym or at home, or even just getting out of a chair. So I have Mike here to demonstrate the squat or a sit to stand for us. So I had him stick a chair behind him just to help him make sure that he's able to stick his hips back as he goes into the squat instead of going straight down where a lot of people let their knees kind of move over their toes. So a couple things to focus on with the squat. Like I said, you want to make sure that your hips are going back towards the chair. You're not letting those knees cross over. You want to make sure they're tracking kind of right over where your second toe would be, if you could imagine an imaginary line straight up from that second toe. And then as he comes out of the squat, he's engaging his core, engaging his glutes to help push himself back up versus anything coming from that lower back, or again, kind of sliding forward and then coming up from there. So go ahead and try some of these changes to your form with the squatting or coming out of a chair. See if it's able to make a difference, and just let us know if it does. You can either comment below, head into our clinic, or even just shoot us an email.